Welcome to a deep dive. Today we're setting the spotlight on a really challenging and often painful intersection of history, psychology, institutional policy, and faith.
Our mission is to distill the facts. We're looking at the history of what's broadly been called conversion therapy and, specifically tracing the roots of aversion therapy at and around Brigham Young University or BYU.
And we're covering a pretty wide span of time.
We are, from the mid-20th century right up to the present. We want to make sure this history is properly contextualized within the evolving medical and religious consensus of the time.
That initial medical context is just so essential for understanding why any of this even happened. If you look back to 1952, the American Psychiatric Association, the APA, put out its first diagnostic manual.
The DSM-I.
Exactly. And in it, they officially classified homosexuality as a sexual deviation, a pathology.
And that wasn't just, bureaucratic language. This was the official stamp of pathology that really governed clinical practice for decades.
Once medicine labels it a disease.
Well, it follows logically that doctors and psychologists would seek a cure. And this provided the foundation for all these therapeutic methods aimed at changing sexual orientation, which included, and this is a key part, aversion therapy.
But for anyone who might not be familiar with that term, aversion therapy is rooted in behaviorism. It's a very simple, almost brute force concept.
It is. You pair a negative stimulus, something painful or distressing, like nausea or an electric shock, with the unwanted behavior.
The goal being to create an automatic aversion.
Precisely. If you associate attraction to men with intense physical pain, the theory, at least, is that you can retrain the brain. And while it took many forms, our focus today is mostly on the use of electroshock methods.
Which were used in research and counseling referrals right there at BYU.
During this era, yes.
Okay, let's unpack this chronologically. We should start with the institutional climate of the 1960s. The tone set by the university administration then. It wasn't subtle.
No, it was explicitly exclusionary and judgmental. We can trace that straight back to 1965 to the BYU president at the time, Ernest L. Wilkinson.
He made it just a devastating public statement.
He did. He stated very plainly that BYU did not intend to admit to campus any homosexuals.
But his comments, the cruelty of them, extended to the students who were already there. He suggested that if any student had that tendency and hadn't completely abandoned it, they should leave.
Leave the university immediately after this assembly, he said, and they'd get a tuition refund. The implication was institutional contamination.
Wow.
Wilkinson's words basically said the university didn't want others on campus to be contaminated by your presence.
You just have to imagine being a student in that auditorium, hearing the head of your institution tell you that you are a moral threat just for existing.
It creates a profound atmosphere of fear.
And that atmosphere didn't just persist, it got worse. Under President Dallin H. Oaks, from 1971 to 1980, the administration ramped it up. It became an active, formal system of surveillance.
That's the really shocking part of this era. BYU security was tasked with identifying, expelling, or trying to cure homosexual students. These purge attempts started in 1976.
And they included things like targeted interrogations of students, right? Especially in certain departments.
Yes, especially those in the fine arts and drama departments. And their reach went off campus.
Which really shows how committed they were to this.
Yeah.
BYU security was going into Salt Lake City, surveilling known gay bars.
The records even show security staff writing letters to potential students, trying to entrap them, soliciting responses as part of this widespread campaign.
That level of internal policing must have created just an atmosphere of institutional paranoia.
It absolutely did, and we see the immediate tragic consequences. In 1976, a BYU music professor named Carlisle Marsden, he died by suicide.
Just 2 days after being outed.
2 days after being outed following an arrest for alleged homosexual activity. It's a devastating direct consequence of that policy.
And it's also critical to note here just how high level the awareness of these practices was. This wasn't some rogue department acting alone.
Not at all. Documents suggest that top religious and institutional leaders, Apostles Spencer W. Kimball, Mark E. Peterson, and then President Dallin H. Oaks, were all aware of the electroshock aversion therapy program during this period.
Although Oaks later denied it, right? In 2021, he said it didn't happen during his specific tenure.
He did, but the contemporaneous records certainly complicate that denial.
So that brings us from this climate of surveillance to the actual clinical research being conducted on campus, the mechanism for these so-called pures.
That's right. And it's important to realize the documented use of aversion therapy at BYU in the 70s. It was consistent with practices at many major universities worldwide at the time.
Like Harvard Medical School, for instance.
Exactly. BYU wasn't an outlier in applying the technique, but its religious context made the stakes exceptionally high for the people involved.
So the most specific documentation we have from BYU comes from a dissertation in 1976.
Yes, by a psychology student, Max Ford McBride.
And what did that research actually involve?
The study documented electrical aversion therapy on 17 men. 14 of them completed the full treatment. The stated goal was to diminish unwanted homosexual desires.
Can you describe the specific methodology? Because this is where it becomes very clear how it worked.
The procedure was highly controlled. They placed electrodes on the bicep. Subjects were shown nude male visual cue stimuli.
The pornographic images.
Essentially, yes. When arousal was registered, they received an electric shock that was described in the paper as barely tolerable.
Barely tolerable. And how did they measure the arousal to know when to deliver the shock?
They used a device called a phallometric gauge, which was placed around the penis to record physical reactions to the stimuli. The timing of the pain was directly linked to physical evidence of attraction.
It sounds incredibly clinical and yet profoundly dehumanizing. And we know that the university's standards office, now the Honor Code office, was referring students directly into these programs.
Gerald J. Dye, who was head of that office in the 70s, confirmed that the SET process for some students required them to undergo therapy to stay at BYU. And in what he called special cases, this included electroshock and vomiting aversion therapies.
Though BYU later denied the vomiting part, correct?
The spokeswoman confirmed the McBride study, yes, but denied that emetic or vomiting therapy was ever administered by the counseling center itself.
But the real weight of this history is found in the personal cost, in the first-hand accounts.
Absolutely. An independent BYU newspaper article detailed the experience of two men in the early 70s. Both were referred to the BYU Counseling Center for this exact therapy.
Using pornographic pictures, and one of them said the treatment was completely ineffective.
And we can broaden that with a case from the UK from the same era, which shows how common this was. A man they call Chris was told by his doctor he could be cured.
He went through months of these painful sessions. His account is one of the most vivid and heartbreaking descriptions of the technique.
He recalled electrodes on his ankle and wrist. A photo of a man would appear, and if he didn't immediately click away, he'd get a hefty electric shock.
But if a photo of a woman came up?
Nothing, no consequence. The clinicians pushed him to pursue heterosexual relationships, guaranteeing it would work.
But it didn't change his sexuality.
No. He did marry a woman he met afterwards. They've been married for 42 years without ever consummating the relationship. Chris said the experience led to over 4 decades of extreme PTSD.
And it destroyed his career, right?
It did. It destroyed his successful teaching career after his history became known.
That is just a staggering human price for medically discredited therapy. And Chris's own statement, I think, sums up the ethical blindness of that whole era perfectly.
In this country, it is illegal to train a dog using electric shocks, but it is not illegal to use electric shocks on a gay man.
Wow. It just lays bare the prevailing beliefs that prioritize control over any kind of compassion.
And this kind of pressure, both internal and external, was mounting. It forced the clinical philosophy to evolve away from physical coercion.
So as behaviorism was failing, the focus shifted in the 80s and 90s.
It shifted dramatically towards psychological methods, what they termed reparative therapy. And this was often championed by professionals affiliated with BYU.
And this wasn't just a different technique, it was a total reframing of the issue.
It was a fundamental conceptual revision. Instead of treating homosexuality as this uncontrollable, maybe biological drive, which shock therapy failed to extinguish, it was reframed as an appetite.
An appetite developed through social learning.
That's the key takeaway. The failure of painful physical coercion led to a philosophy of psychological constraint. If it was an appetite, you could starve it or redirect it.
And A. Dean Bird, who was associated with BYU psychology, he detailed this new approach in 1993.
Yes. His theory suggested that homosexuality was a pathological adaptation, that it resulted from being stuck in a developmental process, maybe due to things like emotional detachment from a father or even sexual abuse.
So the therapeutic goals became really focused on psychological restructuring.
Exactly. They aimed to diminish or eliminate homosexual attractions and instead foster non-sexual, fulfilling relationships with heterosexual men.
So trying to separate sexual needs from these underlying emotional needs, like a need for masculine affirmation.
Right. And this led to some very specific intervention models, like the asexual approach from Richard H. Anderson in 1982. This prescribed a complete sexual abstinence, a mandatory sexual timeout.
So from all sexual activity.
All of it.
Mm.
Homosexual, heterosexual, and masturbation. The idea was to, figuratively starve the sexual appetite into submission.
So if we look back at the claimed efficacy, what did they think at the time?
Well, we see a mixed but generally optimistic institutional view. A 1979 BYU dissertation cataloged aversion studies and claimed a qualified improved or recovered rate of 58%.
But that early optimism it was comprehensively undercut later on.
It was. By more rigorous research, Ariel Shidlow's 2002 study found us a dismal 4% success rate in shifting exclusive homosexuality to heterosexuality.
And worse, a large percentage of the subjects reported suffering from profound psychological and even spiritual harm.
Right. This poor track record, combined with a growing recognition of the deep damage, that's what brought us to the modern era of scientific and institutional condemnation.
The whole medical consensus just shifted dramatically.
It had already started to. The APA began removing homosexuality from the DSM in 1974, though they did keep ego-dystonic homosexuality, unwanted attraction, as a disorder until 1987.
But by the 2000s, the condemnation of these therapies was absolute.
The timeline of professional opposition is just stark. The American Medical Association first opposed reparative therapy in 2000. By 2022, nearly all major medical and psychological associations had condemned these practices,
Calling them unscientific, unethical, harmful,
and potentially deadly. And maybe the most stunning moment in all of this involved the one researcher whose work was so often cited by proponents, Robert Spitzer.
His 2003 study had suggested that some forms of reparative therapy could be effective.
And then, in 2012, he issued this profound and really rare retraction. He disavowed his own work. He admitted that the subjects who reported a change might have been deceiving themselves or outright lying.
That kind of reversal from a major researcher just underscores how flimsy the scientific basis was.
And the stakes here aren't academic. They are literally life and death. We have research that indicates exposure to these sexual orientation change efforts, or SCE, is directly linked to significantly higher rates of seriously considering suicide.
And attempted suicide among LGBTQ youths.
Compared to those who have no exposure.
So unsurprisingly, institutional change followed the scientific consensus. Exodus International, which was the biggest Christian ministry in this space for decades.
They renounced reparative therapy and closed down in 2013. The LDS-affiliated Evergreen International followed suit, merging with another group and ceasing independent operations.
And BYU's policies have also evolved. They've had to adapt. In 2007, the Honor Code was revised to specifically clarify that one stated same-gender attraction is not an Honor Code issue.
Which is a massive step away from the Wilkinson era.
A huge step.
Yeah.
However, the complexity is still there. While attraction isn't a disciplinary offense, the code still bans all forms of physical intimacy that give expression to homosexual feelings.
And the Church's current official stance tries to walk a very nuanced line. They still affirm traditional scriptural interpretations that have historically condemned same-sex sexuality as sinful.
And encouraged change.
Right. Yet the Church now officially states that while shifts in sexuality can and do occur for some people, it's unethical for professional treatment to focus on an assumption that a change must occur.
And BYU, for its part, says studies like the Electroshock one haven't happened there since the 1970s.
That's their official position.
Yeah.
But despite these really significant shifts in formal policy, that institutional tension, it continues to surface.
We saw that as recently as 2022, when BYU banned protests on Y Mountain, a year after LGBTQ students famously lit it up in rainbow colors.
A powerful, visible assertion of identity right against that historical backdrop we've been discussing.
So if we connect this whole timeline to the bigger picture for you, the learner, we really see two primary historical threads intersecting at BYU.
First, the documented use of harmful behaviors therapies, like those electroshock studies of the 70s, which were, typical, albeit cruel, applications of the era's clinical thinking.
And second, those subsequent psychological models, the reparative therapies, that focused on changing behavior by addressing these underlying emotional or developmental needs.
And both of those systems, the physical coercion and the psychological constraint, have now been conclusively condemned as unscientific and actively harmful.
We've charted how quickly entrenched medical and institutional beliefs can shift over 5 decades, moving from considering homosexuality a treatable pathology using electric shock.
To recognizing that same practice as a deeply harmful intervention linked directly to suicide risk. It's a powerful lesson in scientific evolution and ethical responsibility.
So what does this all mean for you? We've established that major medical organizations universally condemn conversion therapy today. Yet some contemporary therapeutic choice groups still argue that because sexual orientation is deemed fluid by some, individuals rooted in their faith who desire change should have the freedom to choose their own therapeutic path.
And this history raises a really powerful question for you to consider. How should institutions navigate that complex ethical space between protecting vulnerable individuals from harmful, discredited practices and affirming the deeply held religious beliefs of those who actively seek therapeutic assistance rooted in their own faith?